welcome back. Well, we have a well-known person I think you've seen on here before. Her name is Dr. Lisa Curcio, and she is now with MemorialCare, which she's a breast surgeon at the MemorialCare Breast Center at Saddleback Memorial Center. Well, thank you for being with us. It's nice to have you.
Thank you for having me.
So, Saddleback Medical Center, I know I sometimes mess that up. So something has changed, and you're now under the umbrella of MemorialCare. Tell me how that's happened.
Well, MemorialCare offered me this tremendous opportunity to be their dedicated breast surgeon, and it seemed like a natural fit as most of my patients were already getting imaging at the MemorialCare Breast Center, and it's a tremendous group of professionals that are in the imaging center and the radiation oncology as well as the medical oncology departments that I've been working with over the past 15 years.
Okay, great. And so let's talk about what your responsibility is. Like, what type of a doctor are you?
Well, I'm a breast surgeon, so I take care of patients who have benign and cancerous problems of the breast. So if you had an abnormal mammogram and you had a biopsy that showed maybe some atypical cells, you would come to me and we would kind of discuss how we would manage that problem.
Okay, so the first person they would see would be their general doctor, and if something was to happen, then they would send them to you?
Well, usually what happens is after they have a mammogram and it's abnormal and they require a biopsy or maybe surgery, usually the primary care doctor will directly refer the patient to myself.
Okay, perfect. And which facility are you located at?
I'm in the Saddleback facility. I'm in the Harvard Eye building, right adjacent and next door to the screening part of the mammography department, the breast imaging department.
Okay, let's talk a little bit about the MemorialCare Breast Center itself. What are some of the things that you guys provide?
Well, obviously services for all of breast imaging. So we're talking 3D mammogram, diagnostic ultrasound, breast MRI, bone densitometry, genetic counseling, and we have a navigator. So these services are all provided under one roof, and now I'm right next door in the same building, the adjacent office to all of those services. So if a patient has a problem, they can literally walk next door and make an appointment to see me.
Now, we have talked to a few other oncologists and doctors about the 3D imaging. Let's talk a little bit about the differences between a 3D imaging and just a standard mammogram.
Right, so standard, probably what was the standard of care before 3D is digital mammography. And digital was a lot better than just plain film mammography. So the advantages to 3D is if you have dense breast tissue, in digital mammography, the density can hide things. But when you have 3D, it is called tomography. And what happens is it actually sections the breast like bread loafing, like a CAT scan would almost. And so if there is a mass hiding behind density, you're going to see that as you section through the breast tissue with the tomography.
Okay, and then I guess the concern would be, are we going to be going to 3D like as an automatic thing and replacing standard, or would it only be for the breast density situation?
That's a great question. I think the studies are still pending whether or not it's superior in all patients. We do know that it is superior in patients with dense breast tissue, and it does reduce the need for callbacks in some cases. Okay. If you had a digital mammogram and they saw something, they would call you back for additional views with the mammography and ultrasound, but oftentimes those things can be sorted out with the 3D mammo. Okay. So there might be cost savings in the end with everyone getting 3D mammo.
Okay, but we're not there yet.
Not there yet.
Okay. And let's talk about when women should be getting a mammogram screening. Plus, also let's talk about the genetic testing that's happening.
So in terms of screening, there's a lot of controversy. And it's no wonder that patients are confused, because I think a lot of physicians are confused, because we have a task force, which was a government-run agency, that tells us one thing. And then surprisingly, a lot of the medical associations kind of piggybacked on those recommendations. But the reality is that these new recommendations are not based on any new data, but more based on the concern for negative biopsies, i.e. subjecting someone to a biopsy when they really don't have cancer. But the reality is, in our society, the American Society of Breast Surgeons, they went back through and really studied all of the data, studied the task force recommendations, and our society came came out just this year in May and said they believe that women should start screening mammograms. Now, the average risk woman should start screening mammograms at age 40 and get yearly mammograms from there. So we are holding strong on that stance. And I do firmly believe that yearly mammograms are the way to save lives in terms of breast cancer. We're already starting to see women who are going 2 and 3 years getting diagnosed with more advanced breast cancers than what we had been seeing.
Okay, and interesting that you should say the 40 instead of 50, because I saw, I think it was on Facebook, where people were holding up signs and saying, I was 40, not 50. So it's people are getting it in 40s, but we're also finding even some in their 20s.
Absolutely. So obviously, those recommendations that we spoke about are for the average risk woman. There are cancers that occur in your 20s and 30s, for that matter. The most important thing is knowing your family history. And in some of those cases, these are hereditary cancers, but not always. So once again, American Cancer Society says we shouldn't be doing breast self-examination. I feel, as a breast surgeon and someone who treats breast cancer every day, everyone should be doing monthly breast examinations, especially women in their 20s and 30s, because they're not being screened with any kind of imaging. So I think it's critical for all of us to be aware of our body and to examine our body. I don't have a problem seeing someone who thinks they have a breast lump that doesn't have a breast lump. I do have a problem with someone who goes, who goes months and months without examining the breast and then feels a 3-inch breast mass.
Right. Right. And then genetic testing, let's talk a little bit about how that works.
Well, I've been a big advocate of genetic testing since early in my career. I actually was diagnosed with breast cancer at the age of 37. So I really think it's critical for those people who are at increased risk to know that and to be able to be screened more frequently and maybe make some interventions to reduce their cancer risk. 15 years ago, we were just looking at BRCA1 or 2. Nowadays, we have panels that are 97 genes long. So we're still learning. I don't think the jury's out yet that we've identified all the genes that can make you at increased risk for breast cancer.
Right, right. Okay, great. And then what is the most important thing about a breast specialist versus someone who's not specializing in that?
Right. I think it's kind of similar to if you had electrical work in your house that needed to be done, you wouldn't call a handyman to do that. You really want, especially electrical work, because there's such major implications about doing that incorrectly, you would want an electrician to come to your house. It's the same thing with breast cancer. If you are treated by someone who does hernias and gallbladders and ER call all the time, are you really getting the same level of care that someone that this is what they do, they go to the meetings, they know the data, they're in conferences all the time discussing what's the most recent treatments out there. I just think the level of care is remarkably improved. And studies have showed that women who go to breast specialists have an improved survival from breast cancer.
Right, and the technology today is so much more advanced than it was, so awesome.
10 years ago, we were treating breast cancer so differently than 10 years ago.
Thank goodness.
Yes.
And if you guys are part of the MemorialCare Saddleback Medical Center, you probably received one of these in the mail. It's called the Care Connection, and Lisa Dr. Curcio is on the pages on this side here. So congratulations to you, and you guys can read all about her. But nonetheless, if anyone has any questions for you or for anything that's involving the breast center, where should they go?
Well, obviously they can go to the website or they can call my office, which is on the website, for any questions or concerns.
Okay, perfect. Well, thank you very much for the time and congratulations on your new opportunity.
Thank you.
And if you need more information, you can always go to memorialcare.org/SB breast. We'll be right back.